Welcome everybody. I am here as part of our Hanukkah celebration this year, 5,781, and I'm really honored to welcome into our space today for a conversation someone who's become a dear friend over the course of the past months, and someone that of us who study on Shabbat morning in Chevra Torah, as well as those of us who have been involved with the Introduction to Judaism classes, have gotten to know really well, and that is Abbie Polos. Now, Abbie, in addition to being a student of Torah, is also a women's health nurse. She works at the Women's and Children's Center here in Greensboro as part of Cone Hospital. Abbie, welcome this year as we're celebrating Hanukkah. And the reason that we've invited you in is not only that you're a really great person to talk with, but also really since the beginning of this time with coronavirus, with COVID-19, you have been someone that we've been talking about and turning to for regular updates on what's going on. First off, how are you holding up these days? How are things with you and how are things with your family?
We're good. We are settling into our new normal. What seemed like a drastic shift in life in March has sort of become our new normal. And it's not even our new normal anymore. I guess it's just our normal now. Trying to navigate the holidays as safely as we can and still, maintain those traditions that we all hold so dear and steaming forward.
Yeah, I'll tell you, your kids right now. Tell me a little bit about what they're doing for schooling. I know that a lot of parents, with elementary school and other age kids, right now things are like you say, settling into some sort of a new normal, but it can't be easy. Go ahead and tell us a little bit about where things are right now.
Yeah, well, we have a 3-year-old and a 7-year-old. The 3-year-old doesn't really know any different. He's just glad to have everybody at home hanging out with him. So I keep wondering what he's going to remember out of all this. And the 7-year-old is actually physically in school. He's in private school and has been physically in school since August. I would not have sent him back if we did not think it was safe. And they have really made an effort to put a lot of things in place, a lot of things that are above and beyond what I would have expected. Look, there he goes right there.
Hey, how you doing?
Above and beyond what I would have expected. They wear masks all the time. They have dividers in between. They have in between the tables that are 6 feet apart. A good majority of their classroom time is done outside, especially if there's got to be close contact between students and teachers. And so it has been very good so far. There he goes again. Very good so far. They've been very lucky. It is not something that I think will be easily applied to public schools, although the statistics and the research I've seen in other countries and other states say that as long as teachers are behaving themselves, the transmission rate amongst school-age children, at least the younger elementary school kids, is fairly low. So we're just holding on to that right now.
Yeah, and I don't really want to get in too deep in terms of what's going on in education, but I can only imagine the challenges. And as I've talked to other educators, Jewish educators, as well as more generally speaking, it seems like, private schools have been particularly, as you were saying, have been particularly well situated to be flexible at this point. Here in Guilford County, obviously with such a large school system, it's been harder to have that type of flexibility. So, again, my best to you and your family and to all the families that are out there now in what really is a very challenging time, to think that the education system would solve COVID for us, just like any synagogue would be able to do it, is probably putting too much of a burden during this particular public health, pandemic and crisis. Speaking of which, take us into the world of your work right now. How long have you been working as a nurse in this context? Kind of build it up for a little while in terms of the type of work that you do within healthcare.
Yeah, well, I am a women's health nurse, which in the cone system encompasses pregnant moms, newly delivered moms and babies together. I don't do babies on the outside, so I don't do NICU stuff, but pretty much runs the gamut of women's health from pregnancy to postpartum. I've been doing that for about 8 years now, with Cone for the better part of 3 years now. And I don't believe in coincidences. The Cone system, we were, of course, at Women's Hospital for 25 years, 20 something years. And in late January, early February, we moved to a beautiful new facility right on the main Cone campus, brand new hospital. It's beautiful, and left behind a fully functioning, still usable, empty hospital. And literally almost exactly to the day, a month later, COVID hit us. And it was, perfect timing. Cone was able to, in a matter of days, I think it was like 20 days or something like that, convert what was originally a women's hospital to serve women and children into a fully functioning COVID hospital. They originally opened a single ICU, which was in the old NICU, which was on the second floor, and converted those larger NICU bays into ICU rooms. And then the bottom floor, which used to be, postpartum with moms and babies in them, became the just regular non-intensive care COVID patients. More recently, I'd say in the past 7 days, maybe 10 days, they have had to surge capacity at Green Valley, that's what we call it now, Green Valley Hospital. And so they did have to open up additional ICU rooms and additional just hospital beds to accommodate the influx, in addition to floors that they've had to open up at all the other hospitals. Cone, Wesley Long, Annie Penn, and Alamance all now have their own dedicated COVID floors.
So if I understand you correctly, things are surging at this point, or well, actually, go for it and tell us a little bit. We are recording this a couple of days before Hanukkah starts, really. So in this first week of December, what do things look like? And I understand, you're not in the administration, but really from the ground level, what do things look like in terms of of COVID at this point, or at least what are you hearing?
Yeah, so I have to commend Cone. They have done a fabulous job of being transparent, of keeping up communication, of keeping us on top of what information we need to know, not just for right now, but for what to expect in the days to come. They have multiple teams working on multiple scenarios that might be played out. And this has been in place since the middle of March. I mean, they initiated a command center that's been the real hub of all of this information, the flowing in and out of everything, the PPE, the number of patients, how we deal with it, infection prevention, everything, which has been, I think, a fabulous model. Having never lived through a pandemic before in the healthcare system, it is, from a nursing perspective, it has been great. They let us know what we need to know when we need to know it. I think as of right now, as far as I know, because they do keep us up almost daily with the admissions, just to put this in perspective, in September, we were running between 30 and 40 total patients in the entire Cone system with COVID. As of maybe 2 days ago, I think we had close to 180. And the Green Valley facility, I believe, can hold 125. I'm not sure. So just imagine what this scenario would look like if Green Valley did not exist. it would be, we are so fortunate, and it really is has provided us a great opportunity to keep doing what we're doing in terms of a healthcare system. What I'm seeing on the ground, women's health has been interesting because it's not elective and it's not scheduled, and we take what we can whenever we can, and we just deal with what we got. So interestingly enough, the majority of patients that we see with COVID are on two ends of the spectrum. Either people that are coming in to have a baby that are getting tested, because everyone that enters the hospital as a patient is tested and had no idea, no symptoms, no nothing. I don't even know where I got it. A large majority of the people are on that end of the spectrum. We do, even though they're asymptomatic, we do all the things that we would normally do. We wear PPE, they wear masks, their support people wear masks, they're in an isolation room, the whole shebang, the whole time. And then the opposite end of the spectrum is they are sick and they are there because of COVID and they just so happen to be pregnant. That's a much smaller portion, but we are seeing that. And it has come in waves back and forth. More recently, I feel like there has been a little uptick in it, but in terms of specifically the women's health part, you know, we just keep having babies.
No, I hear you. And so if someone is just, take me into this, if someone it's revealed that someone has COVID, if they're tested and they have COVID, it sounds to me like there would be a separate section within the women's health, women children's health, specifically for COVID. Everything else is running in another section.
Yeah. Yeah, each floor has converted, each floor already, because infectious diseases existed before this,
Right.
Each floor already had isolation rooms available, but there's only one for the entire floor, which, in flu season, that's fine. But what we ended up doing is each floor has now converted several other rooms that are all clustered together in a close proximity to one another. That provide negative pressure. If you drive by Green Valley, which I encourage everyone to just drive by and leave a little blessing behind, but you'll see the windows and they have these wooden squares and these little silver circles in the middle. Those are big machines on the inside of the room sucking air from the hallway in through the room and venting it out through the window so that any kind of airflow is all moving past the patient into the out of doors, not through the room into the hallway.
And was that something that was in place ahead of time, or that's something that had to be like retrofitted based on the situation we're in?
Absolutely. So when all of this started, I want to say sometime around like March 18th, when we shut everything down, the people who were furloughed or whose hours were cut because they were in elective procedural areas all teamed together and went around to every hospital. They went to Green Valley and we retrofitted those rooms with honestly, I don't even know if where the materials came from, but they found them and they got them. And people who are used to, taking care of moms while they're having babies were like lugging machines around and retrofitting the windows and putting the machines in and making sure everything was airtight. It was pretty amazing to see how we were just like, well, this is what we're going to do.
Rabbi Gutman and I are both very grateful to you because early on, you brought us beyond the headlines. Even as they were developing, one of the things that as again, newspapers and media were talking about the need for PPE, for that personal protective equipment. You were someone who was saying, yeah, from the inside, this need for PPE, for personal protective equipment. One of the things at that time that people at Temple Manual were doing, you had people who were making masks and saying, well, how can I get them to the healthcare system, again, to people frontline? Where does that stand right now?
Yeah, at the very beginning of this, it was a little scary because everything started happening very quickly. And it was odd because the conversations that were happening in the country did not reflect the intensity at which the hospital was responding. Like the hospital started responding immediately, and with what seemed like at the time very heavy hitting kind of things. And we were like, what the heck is going on? This is not what they're talking about on the news. And then 2 days later, we're under state of emergency. And then, and then it all just, like everyone else experienced in the world, all happened just very quickly. And so we were not prepared as healthcare professionals to protect ourselves or protect the patients. The surgical masks were in low supply. N95s for sure were in low supply. And luckily, the interventions that we did early on to shut down the hospital, redistribute resources as needed, conserve them, and then sort of open back up in a fashion that could conserve those resources, I think worked very well. Up until about October. So I guess in mid-March, late March, maybe even into April, we weren't required to wear masks. At some point in there, we all were required. And first, the hospital didn't have enough. So it was just whatever you can cover your face with. If you have something, use that. And so people were just, making their own. We got lots and lots of donations from the community. A lot of nurses themselves started making them, producing them, providing them for one another. And that was sort of the standard for a month or so. And then as things started settling down nationally and internationally, and resources started to become available, Cone was able to stockpile enough procedural masks, not ones you would use in surgery or in N95, but just regular old masks that we can all get now. Enough of those that they started providing them for us, and cloth masks were no longer used. And so that was the standard, although you basically used it until it fell off your face. They said 3 days, but we all became, I totally understand now why my grandparents saved tinfoil. They're like, just flatten it out. It's okay. You can reuse it. Stick it in the drawer. I mean, I have like 5 months worth of PPE that I was like, no, it's still good. We can just tie the end together. It's fine. And so that was the standard until about October. And then in October, they were like, you know what, guys, we've gotten through this. We have enough to supply. They started providing us with numbers. We have enough masks that it'll last us the next year or so. And so we no longer have to reuse them. The surgical masks and the N95s have to be reused still. But so far, we have not had any incidences where we couldn't be provided with what we needed so far. But I mean, the potential still exists, I guess, as things surge and become are needed nationally and internationally. Those supplies could dwindle quickly. So it's hard to anticipate. But right now, we have what we need. We get it when we need it, and it has slowly gotten to that point over the last few months.
Ever since the beginning of this time, we've been doing prayers as part of our services. Obviously, first and foremost, the prayers have been for people who've contracted COVID, for those who are wrestling with this on the physical level. But we've also made sure that there's a prayer for those who are providing healthcare. And I'm just wondering what your views are in terms of where the next steps are. I mean, what messages would you give to people as someone who's involved in healthcare in terms of what needs to be done or what this next path might look like?
Yeah, and we as a family, my core little 4 people who are in our household have been struggling with this right now because it is the season where we're used to seeing the grandparents and we want to be around people and Thanksgiving and all of that. And it's easy to say, it'll be all right. It's just like 2 people, those 2 people, it's not a big deal. And then I'm like, but is it worth it? Is that one interaction, that one night for Thanksgiving, or that one visit for Hanukkah or whatever it is that worth me being sick when 2,000 other people are sick in the state? Is it worth me maybe not being able to get a bed in the hospital? That's the first thing I think about. Like, do I personally want to be sick right now when all these other beds are full? And then, is there another way that I can make this happen without having to interact with them physically? How else can I accomplish it? And I have yet to find a scenario where I could not provide an experience for my family that was safe. Because there are a million different things we can do. And I think, yeah, it's hard. Like, we're used to sitting at a table and eating with people and hugging and singing songs and all of these things. But this is 1 year. If you only want it to be 1 year, then just skip it this year. If you want to miss that person for the rest of your life because maybe they're not here next year because they get sick and they don't make it, that could happen. And those experiences for this year will make it even more sweet next year, when we finally are able to get together. And I think we will get there. I encourage people to get the vaccine. Do your research. I will get it as soon as it is available through Cone, which, God willing, is in the next month or so. But that won't be it. It will take months for enough people to get vaccinated, and we will still have to wear masks, and we will still have to miss a few more birthday parties, and maybe Passover again, who knows, but it will eventually end. And when we look back and think, did I do all the things that I could have done to protect myself and my family? Those answers will be different for everyone. So
yeah, I think most of us are hoping that we can say confidently yes to that question. And I think that last message that you've given us there is really an uplifting message and a message of hope. Abbie, Polos, thank you so much for your time and for your insights today. And to everyone out there, we're wishing you a Hanukkah filled with not only light, but also good health and lots of hope. Thank you again.
Thank you.